Hello, this is my audience. "40 million Americans, or approximately 30% of the American population, suffer from long-term chronic sleeping disorders." Hello, my name is Yvonne Hernandez, and today I'm going to inform you about the sleep problems that have plagued Americans. Some common sleep disorders include insomnia, sleep paralysis, and sleepwalking. These disorders can cause major health problems, including hypertension, diabetes, or even heart attack or stroke. Let's start off today by talking about a problem that many of us have experienced at least one point in our lives: insomnia. According to Dr. David Boyce at the Journal of Lifelong Learning in Psychiatry, insomnia is the most common sleeping disorder, affecting 30 to 40% of Americans. Insomnia can either be defined as a symptom or as disorder. Insomnia is a symptom when one has trouble falling asleep, staying asleep, or getting a good night's sleep. Insomnia becomes a disorder once a person has physical or mental disabilities. Insomnia is more prevalent in psychiatric care and has been shown to accompany depression, anxiety, and mood disorders, according to Medscape. Likewise, having insomnia can lead to further psychiatric problems that were never present before, such as substance abuse. Treatment for insomnia is available to those who seek help. There are multiple ways to treat insomnia. However, most doctors recommend treating the underlying psychological issue at hand. Many times that is depression. While those with insomnia long for sleep, there are some that are too afraid to go to sleep. Which brings us to our next subject: sleep paralysis. Sleep paralysis occurs whenever a person is in the limbo between being awake and asleep. Many people describe sleep paralysis as the inability to move or to speak out. Many people also describe feeling breathlessness and a loud ringing in their noise. Even scarier is whenever people sometimes describe seeing a shadow approaching them or footsteps approaching them. According to Dr. David McCarthy at the Journal of Clinical Sleep Medicine, about 20 to 60% of Americans have experienced isolated sleep paralysis at one point in their lives. The breathlessness that many people feel, they describe it as somebody sitting on their chest, as this picture right here shows. One account of sleep paralysis is Garrett Fletcher, who said that sleep paralysis began whenever he was 16 years old and abruptly stopped once he left college. Nobody can explain why sleep paralysis occurs and then stops abruptly. One method to help relieve sleep paralysis is to have a good sleep routine and to get plenty of rest and sleep about 6 to 8 hours a week. Antidepressants are available for those who have sleep paralysis who suffer from narcolepsy as well. While isolated sleep paralysis keeps one from moving out of bed, let's discuss another phenomena that keeps people out of bed: sleepwalking. Sleepwalking occurs in about 1 to 15% of the general population, and it's not associated with other psychological problems, according to the National Sleep Foundation. Sleepwalking is more common in children, but can persist into adulthood. Children who experience bedwetting, sleep terrors, or sleep apnea may have a higher prevalence of sleepwalking. Sleepwalking consists of sitting up during sleep, walking around one's house, or even driving long distances with no recollection of this. Alcohol and medications may be responsible for triggering sleepwalking in adults. It is common misconception that you should wake up a sleepwalker, that you should not wake up a sleepwalker. However, this is false. To prevent further injury to a person with sleepwalking, it is important that you wake them up no matter what you have heard. Another way to prevent people from getting injured during sleepwalking is to set up gates by staircases and lock all windows and doors. At the end of the day, many people look forward to crawling into bed and getting a good night's sleep. However, there are many who dread sleeping, despite how much their body might crave it. For those with sleep disorders, lack of sleep may lead to greater physical and mental problems, wreaking havoc on their personal lives. Sleep is not only a privilege, but a necessity to all living creatures on Earth. Major health issues arise when sleep is taken away from a person. Perhaps that is why many countries use sleep deprivation as a form of torture. Anyone you know who is suffering from a sleep disorder, you need to suggest that they get help immediately. With a good night's sleep, a person can accomplish their wildest dreams. Any questions?
How can insomnia lead to causing a stroke?
Insomnia can raise blood pressure, which can form a clot that can travel to the brain and causing a stroke. Any other questions?
I've experienced sleep talk before. Is that some sort of form of sleep disorder?
Actually, sleep talking is considered part of sleepwalking. And sleep talking is very common, and sometimes it can run in families. So chances are, if you sleep talk, there's somebody else in your family that sleep talks. Any other questions?
Yes, having gone through sleep paralysis, what's a way you can prevent it?
Sleep paralysis can be prevented from having a normal routine. So that does consist of going to sleep at a normal hour every night and waking up at a normal hour every day. So whenever the schedule is disrupted, many studies have shown that that can lead to sleep paralysis. Any other questions? Thank you so much for listening to me today, and I hope you all have a great day.
You too. Thank you.
Thank you.